Hello everyone. Erysipelas. So what is erysipelas? Erysipelas is defined as a superficial cutaneous infection. It mostly affects the dermis and the prominent lymphatic involvement also will be involved. Mostly it affects the children, infants and elderly. There are some predisposing factors that will cause this or lead to this erysipelas, which is, for example, skin lesions, venous stasis, neurologic disorders, diabetes mellitus, and alcohol abuse. The etiology that causes erysipelas, or it's for the first, it is beta hemolytic streptococci, mostly in the first place, and then it comes also group A streptococci, for example, Streptococcus pyogenes, and it can also erysipelas can also be caused very rarely by streptococci of group C and G. What are the clinical features of erysipelas? First, it can affect the face or the legs. We can see cutaneous lesions, for example, localized swollen painful erythema. Also, it can spread rapidly to other tissues and it can be seen clearly with red margins and demarcations here, as you can see. So it can differentiate itself from other healthy tissue by these one demarcations here. Also, we can see the marked edema and blood formation. Sometimes it can happen, and also in the face, it can cause a frequent swelling of the eyes and shut. Also, it can be combined with chills. The patient can feel chills, fever, and also general toxicity, such as vomiting, headache, nausea, and so on. So the erysipelas skin infection can be diagnosed with first by checking the clinical signs of the disease, as we mentioned earlier. Also, it can be distinguished from other forms of cutaneous infections, such as impetigus, by two features. The first one, it is the lesions that are raised above the level of the surrounding skin. And the second one is by a clear line of demarcation between involved and uninvolved tissue. The treatment for erysipelas, it is first line therapy, which is penicillin, and it can be used parenterally or orally. Depends on the severity and the case of the patient. And also in case of staphylococcal infection, then we can use flucloxacillin, clindamycin, cefazolin, and erythromycin. Also, we can use additional treatment in combination to those. We can use it also orally or parenterally for pain relief and reduction of fever. And the others can be, for example, disintoxication therapy, and also it can be NSAIDs or NSAIDs, non-steroidal anti-inflammatory drugs. With this, I will end this one. Thank you so much. Goodbye.